if you get to the point where, you know, surgery is really maybe your best or maybe even your only option, it's still, you gave me a list of things, and the first one was outpatient spine surgery, and my thought was, okay, is that a real thing? So it's hard to imagine having some surgery on your spine, such a sensitive part of your body and so important. It's hard to imagine doing that outpatient. So, I mean, could you, is it done in a hospital setting or more like an ambulatory surgery center? Or?
Yeah, so it's actually done both.
Okay.
So we do a lot of the surgery now that we do is predominantly either outpatient, so home same day, or some people stay usually one night overnight in the hospital,
okay,
and then they're able to go home the next day.
Wow.
So our techniques, the nursing care, the anesthesia care with pain blocks and things like that are, you know, emerged so much over the last several years to where we can really get people up and moving a lot quicker. And so much of that, the kind of the roadblock, so to say, initially right after surgery is just kind of, a lot of it's that fear of
I was gonna say, it's
the unknown.
mental.
You had your neck pain, your back pain, but this is a different type of pain, and you're not sure what that means or what, you know, you don't want to hurt something. And so if we can make you comfortable enough to kind of understand, here's the normal biomechanics, what you can and can't do, then, you know, now it's all about rehabbing. And so now it truly is just getting you back to life.
But then I thought, gosh, I don't know if I would be, you know, somebody my age, you know, I'm in my 50s, you know, does age play a factor?
So age does play some sort of a factor. I think some of it has to do with the extensiveness of the surgery itself, okay? So for instance, a lot of the neck surgeries we do, we actually go in through the front. So we actually, the majority, I'd say 90% of the neck surgeries we do for the cervical spine, we go in through the front, we just kind of move things over. And so you don't have that as much of that pain. You do have some pain in kind of your back of the neck and your trapezius muscles just from stretching things back out to normal alignment. So even, you know, I even do up to 3-level fusions in the neck, and people can still go home the same day. You know, a lot of things now, our understanding of cervical spine surgery especially has really changed over the last several years. We do a lot more disc replacements, at least in my practice, than fusions. And so the whole idea is to maintain that normal, you know, motion of the neck and the mobility. So before, with a lot of our studies, they were always on like predominantly younger patients, didn't have a lot of wear and tear. But as now some of our other studies have come out, we're understanding that even patients with pretty degenerative necks, we can still do motion preserving surgery, disc replacements on them, and they still do really well long term.